The Ministry of Health and Wellness is advancing its efforts to modernize the local health system and transform its service offerings. Critical to this upgrade is the improvement of key infrastructure in hospitals and support systems in all public facilities.
All right, so here to discuss, Chief Medical Officer Dr. Jacqueline Bisesa McKenzie and Head of the European Union Delegation to Jamaica, Her Excellency Marianne Van Steen. Good morning, ladies. Welcome to Smile Jamaica.
Good morning, ladies.
Hi, morning.
Good to have you with us. All right, so Doc, may I start with you? We're upgrading, so it would be nice for you to give us a snapshot as to the state of. I think we're all high level aware, but tell us a little bit about what's happening in that sector and how upgrading it can actually help us to beat some of the NCDs that we have here in Jamaica. And then we'll bring in Her Excellency to talk about how the EU is helping us strengthen what we have.
Okay, well, first of all, morning to your listeners. The health system in Jamaica, the health delivery system, comprises of 25 hospitals, and we have 325 primary care facilities that are operational. This network of health facilities, especially the primary care system, was designed from the 1960s, 1970s. And over time, our needs have changed. The epidemiology of disease in Jamaica has changed. At that time, there was a heavy component on treating communicable diseases, as well as dealing with the maternal and child health issues that we had. Over the years, though, what we have seen is that the non-communicable diseases, hypertension, diabetes, cardiovascular diseases, cancers, mental health, those have increased to the point now where you've heard the statistics, 1 in 3 Jamaicans have hypertension, 1 in 8 have diabetes, and 1 in 2 are obese or overweight, which puts you at high risk for developing these non-communicable diseases. As such, the strengthening of our health system needs to look at the overall comprehensiveness in terms of the quality of care and the meeting the demands, the new demands of the population, as well as the population is aging. And so therefore, we're going to start getting top heavy with persons over 60, and these persons would have an increased risk for non-communicable diseases. So we have to strengthen in order to manage that. And at this time, the Ministry of Health and Wellness is looking at both primary care and secondary care, how it is that we strengthen this. And this project, the Health System Strengthening Project, that is funded by the European Union and the Inter-American Development Bank, is really an excellent project that looks at a continuum of care, at strengthening NCDs from the community to the primary care centers to the secondary care centers. It has 2 components that feature heavily in component 1 on infrastructure development, ensuring that the infrastructure that is in place meets the new demands of the population, so that the upgrade of our hospitals, and we're upgrading 3 hospitals, Spanish Town Hospital, St. Anne's Bay Hospital, and Maypen Hospital. But it's not just building a new facility, it's ensuring that these facilities will meet the demands because of the change in need of the population. So the introduction of new specialties in these hospitals, the infrastructure to be able to manage those new specialties, the increasing of services where it is that there is increased demand. That is what, especially for Spanish Town Hospital, which is where the bulk of the funding for the hospitals are going to. There is
necessary.
Yes, very, very necessary with the large population that there is. But quickly, just also to say that it's not just the hospitals, but the primary care centers that support these hospitals. So what you have is a strengthening of the whole network of delivery, so that patients that are seen in the primary care system, we're able to manage better their non-communicable diseases to prevent them from advancing to requiring secondary care.
Okay.
And then also a step back to the community, where through our chronic care model, what we're doing is engaging the community to take care of themselves and their members, to prevent them from having to reach to the primary care facilities too late, and of course advance into the secondary care facilities. And then overall, to cement that, what we're doing, the other component of the project looks at the policies and the programs itself for managing NCDs to ensure that our healthcare workers are suitably strengthened and armed with the knowledge to improve care. And then the electronic health record system, a part of the information systems for health, where we're using different technologies to ensure that there is connectivity of the system and easy access by the patient.
All right, thank you, Doc. That was very comprehensive. Ambassador, so how does the EU fit into this upgrade?
Well, first of all, good morning to everyone. Thank you for having me here. Well, as you know, and also before the pandemic, health is really one of the major, most important fundamentals of every society. And the European Union has been assisting Jamaica, as well as other countries in the world, to build a strong, resilient, robust health systems in various areas. We've been helping a lot on maternal health in the past. We've been assisting with COVID. And this new project of the Ministry of Health drew our attention because we think it's extremely important to look also at the long term and actually to build that resilient health system. It is important to also look at infrastructure, equipment, and at non-communicable diseases, to where the doctor has referred already. So we decided to come in and to do our little top-up of a big and very important program of the Ministry of Health called the Government Health System Strengthening Program. But we're not the only ones. Actually, this program is being financed mainly by the government of Jamaica, by the Jamaican citizens through the state budget, and a very important loan of the International Development Bank. What the European Union is doing is actually to top it up with a grant. And the good thing about the grant is that this does not need to be paid back.
Right.
So we're actually giving 10 million euros to the Jamaican government in order to strengthen its own health program. And I wanted to actually say that in Jamaican dollars, but I calculated it. It's more than 10 digits. I cannot pronounce it. But it's quite a lot of money. But yes, we very much hope that that will help the government to face all the health challenges the country has.
Yeah. Doc, the scope that you outlined is very vast, the scope of work. I'm curious as to, so we know you have 10 million euros from the EU. What other funds have been pledged, whether through government or through the IDB? And what is the timeline to get all of this work done? Because I see digitization on this, and it's something that people have been calling for a long time, connectivity of the network. I'm curious as to how long it will all take.
Okay, so the project started out as a 5-year project. Because of COVID, there have been some delays, and so we are hoping that we will extend a bit beyond, maybe for another year. A lot of the project is some of the hard work, the time-consuming things have already been achieved because we have been going through the design of the facilities, and we have complete. You will see tomorrow in our launch, if you're able to visit, you will see some of the designs that have been put down for Spanish Town, Maypen, St. Anne's Bay Hospital, and the 10 health centers that are involved. So that took up a lot of time, and but we are almost complete where that is concerned. Some of the facilities, most of the facilities are finished in terms of our initial layout and need to complete the design stage of the drawings. So that is a big thing out of the way. We have also upgraded the laundry equipment at the Spanish Town Hospital, and that was also another weakness that we saw there. And we have also started the procurement of the equipment that is to be funded under the project. In terms of the policies, we have already started with some of the digital technologies. We have rolled out putting in infrastructure for electronic, for information systems for health in 105 facilities. We
Okay.
signed that contract recently, and that work is already underway. We have been working with some of the other digital technologies in terms of the development of the Jamaica Moves app, where persons will be able to put in their figures in terms of their hypertension, their diabetes, so they can be managed remotely. We've also been working on the ECHO model that has been rolled out, which is a means by which we can have continued medical education right across the island to all our practitioners in primary care, secondary care facilities, so that they are updated regularly and that the comprehensive management of cases occur even at the primary care level. So many things are already underway. The infrastructure, of course, is going to take the longest time. For 2022, we are hoping to roll out the start of some of these infrastructure works, now that the first part of the designing and the all that necessary work is almost completed. And then in 2023, we would be adding more of the facilities on in terms of starting that infrastructure work. So we are hopeful that the infrastructure work will take maybe about 2 years to complete. And we are expecting and we're pushing for that to be completed during the project time with not too much extension. Although, as I said, with COVID, we would expect that there would be some extension. So we're on our way.
Yes.
Still a lot of work to be done. Of course, what people see is the infrastructure, and they judge you if they don't see the blocks start going up. But a lot of work has been done. The project team is very hard-working team, and they have been working assiduously to move the project along with the support from both the European Union and the Inter-American Development Bank and our own PIOJ.
Ladies, thank you so much. Very, very heartened to hear all that you've said. And as I told someone earlier at the top of the show, Jamaica is looking at 60 years next year, and it's a great gift for us to have the upgrade of our health systems and our facilities. So thank you so much for speaking with us this morning. Chief Medical Officer,
you,
Dr. Jacqueline Bisesa McKenzie, and Head of the European Union Delegation to Jamaica, Her Excellency Marianne Van Steen. Coming up, we talk about safety for the Christmas. We'll be right back.